There are many reasons that people have trouble sleeping. For veterans, things like stress and change of routine can deeply affect their sleeping habits after service. Stay with us as we discuss veterans and sleep issues. Anyone who has ever served knows that it's not a 9-to-5 job. It often requires that you work and sleep during odd hours. It's common for those who serve to sleep in unusual places, sleeping when they have the chance. But those same servicemen and women may find themselves unable to sleep soundly after leaving the military. Over 50% of veterans report difficulty sleeping. Welcome to Veterans Voices. I'm Elena Kim. Tonight, we'll be talking with veterans and clinical professionals about sleep issues. If you're watching live, we want you to be a part of this conversation. Call us at 925-313-1170. Send us a message through Facebook at Veterans Voices 1 or email us at veteransvoices@contracostatv.org. We want to hear from you. My co-host tonight is Army veteran Stephen Burchick, and our first guests are all veterans who have suffered sleep issues. Please welcome Reverend Anime Tabanek, Navy veteran Jet Garner, and Army veteran Raymond Villaseñor to the show. Raymond, let's start with you. Can you tell us a little bit about your military career?
Yeah, I served with the 101st Airborne Division at Fort Campbell, Kentucky. Joined the military right after high school as an infantryman and served for 3 years and reached the rank of sergeant.
Awesome, very cool. And Anime, can you tell us a little bit about your military career?
I served in the U.S. Army as a helicopter crew chief, working on Hueys and then later on Blackhawks. I was deployed during the first Gulf War to Kuwait, and I also was deployed to Bosnia during the Civil War.
Excellent. Sounds like you saw a lot. Jet, can you tell us a little bit about your time in the military?
Sure. My name is Jet Garner. I served in Hawaii with 2nd Battalion, 3rd Marines as a Fleet Marine Force corpsman, so essentially a medic for the Navy. Medic for the Navy and acting as the Marines, and deployed to Afghanistan in 2009 and 2010.
Thanks, Jet.
Jet, while you're up there, can you tell us about your sleep issues after leaving the service?
So, over time, I've suffered a handful of different sleep issues. Anything from kind of intense nightmares to the nightmares leading to sleep avoidance, as well as like jerking in the night. It could be the sleep apnea related. I'm actually not diagnosed with sleep apnea, but I mean, what some of the doctors were describing earlier with jerking awake and unable to sleep afterwards, even in all kinds of interesting things like giggling in my sleep. Apparently, whenever I have nightmares, it's something that my partner tells me that I do. So all kinds of interesting things there, and they've changed over time.
Raymond, can you tell us about issues you may have had?
Yeah, I was diagnosed by the VA with mild sleep apnea. I wasn't aware of it until, in the military, I will snore. You know, my battle buddies would tell me that I snore a lot, but I wasn't really aware that I'll stop breathing until my wife pointed it out to me that I stopped breathing in my sleep. So that's when I decided to check it out and stuff. And I've been trying diligently to get better with that type of stuff since then.
Snoring can be an issue on ambush sites. I think your buddies would point that out. Anna Marie, can you describe some issues you may have had after service?
Sure. I didn't sleep. I didn't even realize I wasn't sleeping. I had been sleep deprived while I was in the service. In particular, the last year, I was pretty much only getting about 4 hours of sleep per night. And so when I came out, I had a lot of physical problems, and I didn't realize until one of my doctors said, "Hey, how's your sleep?" And then we reoriented what we focused on. But I was waking with nightmares and panic, heart racing, sweating, my eyes bulging out of my head, kind of thing. And then, of course, like others have mentioned, like not wanting to go to sleep because not wanting to experience that. But initially, a lot of hypervigilance around the property, what's going on, who's in the neighborhood, windows, doors, all kinds of things like that as well that was keeping me awake. Mm-hmm.
Thanks, Anne-Marie. Anna Mae, I'm sorry. So we talked about nightmares. It sounds like there's a theme that everyone's experiencing nightmares, and then that kind of leads to some sleep avoidance. Ray talked about sleep apnea and how that affects your partner. This is just kind of a question for the team, whoever wants to get us started. How did these issues affect your daily life, whether it be, I was in school or I was working? How did it affect your relationships?
Jet, how about you?
I was going to say, I don't mind starting. So mine started actually in Afghanistan, my first tour. I started just getting these really abstract, like nothing war related at all, just hyper violent, weird, graphic dreams that would be so bad that sometimes I'd wake up and I wouldn't know that it was a dream. Like personally, like my least favorite kind of nightmare is the kind that happens in the same room that you went to sleep in. Mm-hmm. Because when you wake up, like you just don't know what's real and what's not. There's that whole several moments of confusion, and then you're just scared to go back to sleep. And so, I mean, here in Afghanistan or afterwards, working a job, you just end up sleeping less and less and less. That becomes a cyclic problem. And next thing you know, I mean, it affects job performance. It'll affect your awareness at work. Attention to detail starts slipping, and just everything just cascades. And then you feel bad about it, and it just snowballs. There's just no positives until you figure out, some way to get that under control.
Yeah, Jed, I wanted to ask you to keep going on that point, because you're talking about these really hyper-realistic dreams and how that kind of affects with your perception of reality, especially in those waking hours. Mm-hmm. And that would affect, obviously, your day-to-day performance on the job. But I'm assuming it would affect your mood as well. And so what did you kind of do or find within your own therapy to sort of help with the effect that it had on your mood and you personally?
So in combat, it was heavily like me just trying to work out. I would just work out instead of sleep. Mm-hmm. And that's probably a pretty common thing because you have nothing else to do. If you're deployed, there's kind of not a lot of ways to avoid it. After the service, how I started working on things was trying to be in a less stressful environment.
Changing your environment.
Absolutely. Yeah. I learned, because I've never taken medication for sleeping specifically. And the only thing that I'd say has worked over time is reducing stress in my everyday life and changing the environment to one that, I feel safe.
Tell me a little bit about that environment. How did you change? Did you get outdoors?
I did. Here, all my pictures are all me outdoors. So yeah, after I graduated college, I took a trip on the Pacific Crest Trail. I did about 2,000 miles of it. And it radically changed. I thought I was just going to be out there because, a 2,000-mile walk, that just sounds like fun after college, right? And I ended up confronting a lot of my inner issues and a lot of things that I didn't realize were so wrong. And it helped me a lot. And afterwards, I pursued more outdoor trips. I've actually gone to work with other veterans and different nonprofits pursuing that, because just changing the environment. And all the endorphins and the positivity you get from camaraderie, a lot of that has alleviated some of those more severe symptoms for me over time.
Interesting, yeah. Raymond, how did you feel that the sleep issues, especially with the sleep apnea, were affecting you in your daily life when you were awake?
Yeah, I just noticed myself being more fatigued. And I didn't know if I was like making that up in my head, like, oh, I'm tired. Like, I'm just going to make that excuse up. Or is there a reason why I'm tired? And then started looking into sleep apnea, and I started trying to find these answers and seeing how that could not leave you well rested, and, you know, waking up periodically throughout the night, not getting those full sleep cycles in, and reading about how all that affects you. Provided some answers, and I noticed it'll make me more irritable, just grumpy, and I'm a grumpy guy in the morning. And just tired. Like, that's like the biggest thing, like the irritable and being tired all the time. And it's like exhausting. And like, I didn't want to like live that life, you know? So, since then I've just been trying like really hard to find those answers, trying to wake up and have a good sleep hygiene, and, you know, make sure the first thing I do in the morning is get some bright sunlight into my eyes outside, and just doing things like that just to get better.
And Anime, what about you? How did your sleep issues affect your daily life?
Well, I was sort of running on empty, and I drank a lot of coffee because I was just really tired. Of course, I didn't understand that that was having an impact on my sleep as well. But I also, it really affected my body. Like I started having a lot of headaches, real severe headaches, and a lot of my internal body just sort of started kind of collapsing. I just started having an awful lot of medical problems.
Oh, wow.
But I also wasn't compliant with some of the procedures or protocols that, you know, that the doctors were recommending. They were saying, you know, try this, you know, like some sleep hygiene, or try this medication. And I lacked trust in the system, and I lacked trust in the medication. I was afraid that something would put me asleep and then I couldn't react and respond. And that was more frightening to me than not having sleep. So some of that was for myself.
Yeah, really interesting.
Yeah, it sounds like each of you wound up seeking some help, but was there a period in between there where you tried to self-medicate? You know, somebody mentioned coffee and caffeine. Did you try changing diet with the beverages, or using or not using energy drinks? Or how long did it take you to reach a point where you say, I need some outside help or some professional help?
Well, it took me 12 years before I would go to the VA.
Yeah, that's a
Because I
common
just
thing that
didn't
we hear
trust
from
anything to
veterans.
do with the. I had seen some of the medical care that we received in-house. Not to put anybody down, but just some of it wasn't par, and and also just the stress of being around other veterans. So avoiding just the whole system itself.
Yeah.
So it took me 12 years before I was even willing to go get help.
You said the VA. Did you talk with a private doctor before that, or not?
Yeah, I received private medical care that I paid for, and you know, was seeing neurologists, seeing actually a variety of specialties, but on the civilian sector, nobody even asked me about my military experience. Nobody asked me about any kind of exposures I might have had or any kind of trauma. It just wasn't a factor in any of the assessments.
Yeah.
Raymond, what about you in terms of the length of time to seek help?
I started going on Reddit and seeing what other veterans were doing, and then started listening to neuroscientists like Andrew Huberman and seeing what he recommended. I tinkered with the idea of like smoking weed before going to sleep, because a lot of people say it helps them fall asleep. Never did that though. And then after about like probably a year and a half or 2 years, I went to the VA and they did a sleep study test on me and diagnosed me, and they provided me with this like little machine that I put in my mouth, and it's supposed to build the muscle around my tongue to prevent my tongue from like blocking my airway, I guess.
Okay, that's great. Jet, we've only got a couple minutes left. What was the period of time before you sought some professional help?
I ended up seeking help while I was still in the Navy, and I ended up being processed out as a result, honestly. But at the time, we talk about self-medicating. Like I definitely was. I was on the drinking track. I would drink so I wouldn't have nightmares, and it would also help me stay awake. So that was my unhealthy habit of trying to deal with it.
Yeah, I would assume that the drinking, you when you're taking a drink before sleep, you think, oh, maybe this will calm me down enough so that I won't have that sleep avoidance problem too, right?
Right. Like that's at least what you think. Like you think that it's because you don't dream. But then, of course, any sleep expert is going to tell you that the quality of sleep you're getting is going to be radically just awful.
Yeah.
If you're drinking to avoid having nightmares, then your sleep is going to be even worse, if existent at all. And then again, that same snowball is going to happen where daily life is going to be severely affected if you even keep it up, right?
But did the drinking, so you're drinking to avoid sleep, or you're drinking to avoid nightmares, did it even help? I've never heard drinking helps avoid nightmares.
When I was, it's kind of sort of a thing, I would say. When I was in this is when I was still active duty. When I was still active duty, I would get blackout drunk probably multiple times a week.
So you're going to that extreme.
In that regard, yeah, there's no dreaming because, you're blackout drunk anyway.
Yeah.
But of course, that naturally had really severe issues with work. As an active duty sailor at the time, didn't take long for any of my command or my bosses to be asking questions regarding that, what's going on, etc. And that led to me like turning myself into psych basically and trying to get professional help.
Well, we've talked about a couple of things that folks have tried on their own. When we return, we're going to add some clinical professionals to the conversation and discuss what are some of their solutions to sleep issues. So stay with us. We're talking about sleep issues with veterans. If you're watching live, we invite you to be a part of our conversation. Call us at 925-313-1170. Send us a message through Facebook at Veterans Voices 1 or email us at veteransvoices@contracostatv.org. We want to hear from you. Now we want to add Dr. Tara Neavins and Dr. Savoy Varghese to our conversation. Welcome to the show. Dr. Neavins, I want to ask you first, we know that a lack of sleep can leave you tired, as our panelist has mentioned, but how important is good sleep as a whole?
Thank you very much. And from the outset, I'd like to say that although Dr. Varghese and I both work at the VA, the views we represent and speak about today are in no way intended to represent the Department of Veterans Affairs. So yes, sleep is extremely important for reducing anxiety and depression. And as our veteran guests have talked about, it's also impacted their work lives, their relationships. And it's hard to heed some of that advice about having good sleep practices, but it's really important as well.
Yeah, that's our team had just talked about how there's getting the advice and then there's the struggle with actually implementing it. Maybe you can help us a little bit, Dr. Neavins, with understanding what are some of the long-term effects of bad sleep?
Bad sleep can definitely create problems at work again, relationships. The toxins can build up in your body, and your body and your mind don't get thorough rest. And I know Dr. Varghese has expertise in this area as well.
Yes, Dr. Neavins, I totally agree with what you said. Our brain is a very complex organ, and sleep is really important for our brain to have normal function. When during daytime, when people work, there's a lot of metabolic waste accumulates or adds in our brain. And there is a system called glial lymphatic system that helps these waste products or waste things to get out of the brain and make it clean for the next day to function. And sleep is the time when this system activates. Without sleep, these metabolic waste will not be removed from our brain. So you can only imagine if you don't sleep, the more toxic agents will accumulate in the brain and the brain become more and more dull and the person cannot function and all sort of problems will come.
I understand there's a graphic that describes this, Dr. Varghese. Can you briefly run us through this graphic on sleep patterns?
Yes, this is a very complex diagram. You can see here the wake-sleep architecture, and I can quickly run through the process here. It's mentioning two ages, age of 23 and age of 68. You see there are various stages in sleep called the sleep onset, rapid eye movement stage, where the dreams happen during the sleep time. And then there is a non-rapid eye movement called N1, N2, N3 at the time when the sleep is really deep in the brain. And that's a time when the glial lymphatic system activates and all these waste products are removed from the brain. And during the same time, new networks are formed in the brain called synapses, which is very important for the daytime memories you collect, whatever information you collect. During that time, this N1, N2, N3 time, it's like you remember if anyone has worked in the computer, consolidation happens. All these things will consolidate in one, storage happens properly so that you can remember in the next following day. So you can only imagine if sleep is messed up or if sleep is not really happening, you cannot have the waste products removed from your brain and you cannot have the synapses formed so that you will struggle to remember things. And sometimes people develop a dementia, Alzheimer's dementia and all later when people don't sleep.
I noticed on the graph the one key point was the age. One was 23, one was 68. It looked like, as a general conclusion, that the older you get, the more problems you might have.
Yeah, I can add to that too. As you get older, you have less dreaming sleep and less restorative sleep. And you tend to have more fragmented sleep where you wake up frequently. So age is definitely a risk factor for insomnia, other sleeping issues. And a few people mentioned alcohol and cannabis. So what happens when you use those is, you're blacked out and you are asleep, but you're not getting to that dream sleep. And as you said, you used it for nightmares, which can work in the short term. But in the long term, you want to make sure you have that dreaming sleep.
And Dr. Neavins, are there simple things for our viewers that can contribute to better sleep, that can help them sleep?
Definitely. So there are several different things. We call this sleep hygiene, and I believe Jet had already mentioned that. So this is really having good sleep habits, and I think Anna Mae mentioned it as well. All three of you did. So one of the first things you want to do is really avoid using electronic devices about 30 minutes before bed because of the blue light. You might also get an exciting message or a less exciting message or something that stresses you out. And then you're all animated and worked up, and you don't want to be all hyper aroused before you go to bed. So put that stuff away. And if you do wake up in the middle of the night, don't go and check your email. Okay, we all do that. That's not good. Or don't go smoke a cigarette. A cigarette is a stimulant. Okay, it's not going to put you to bed. The bed is only for sleep, sex, and sickness. So the 3 S's, sleep, sex, and sickness. Don't watch TV in bed. Don't do all the things that we're tempted to do. They don't work well. Remove naps. Okay, easier said than done. We all like our cat naps, but keep them under an hour, maybe 20 minutes, and try to do that before about 3 p.m. Otherwise, it's too close to bedtime. Okay, next one, have a fixed bedtime and wake time, even on weekends and during vacations. I know, kind of a downer, but if you're really dealing with insomnia, that's a good way to deal with it. Avoid caffeine and alcohol. Caffeine blocks adenosine, which is the chemical in your body cells, which increases sleepiness. And there's a difference between being tired, where you're just like physically exhausted, you wish you could sleep, and being actually sleepy, where your eyes are ready to close. Don't get into bed until your eyes are ready to close. A few other quick things. Try, if you can't sleep within about 20 minutes of going to sleep, of laying in bed, get up, do something boring. So read something, an encyclopedia or something, or just something that is going to be non-stressful. Make a worry list, but don't do it right before bed. Don't write the 20 things you're concerned about, because then you're gonna have dreams about it. Not good. Don't watch the clock, okay? A few other things. You have a good sleep practice where maybe, you wash your face, you brush your teeth, you listen to some downtime music before you go to bed, about 30 minutes. Exercising, most people don't do well if they exercise at night. A few people do. Know your body. And learn about sleep. So those are all some basic things to help you to really sleep better.
It's interesting. I'm an Army veteran, so I've heard all of these concepts from the VA, but I'm also a mother of a 2-year-old. And that's where it really started to sink in for me, is when you're trying to get a 2-year-old to sleep, and you're on the internet and you're really researching this stuff. Everything that you just said works for a 2-year-old as well, except the no naps. They need the naps, but as adults, it probably wouldn't be as helpful for us. But you listed a lot of things there, Dr. Neavins. I want to turn it back to our team of veterans here. Of all of those things, and this is part of our viewer question too, of all of those things listed, we have a Facebook question. What's the number one method that you are using regularly currently to go to sleep and sleep solidly? It could be something that Dr. Neavins mentioned, or maybe your own trick.
Mine, I'll start off. Mine is trying to wake up at the same time every day, including the weekends, to make it a habit, and just to convince my body that this is when we wake up.
Yeah. You're sticking to that routine. I like that, Raymond. Anna Mae, what about you?
I'm trying to do a breathing technique, actually, to relax myself. And also pay attention to how I'm thinking about not being able to go to sleep. And then, with that awareness, sort of let that thought go, and then focus again on my breathing and trying to slow my body down.
I like that breathing, because it brings together the mind-body connection, right? Jet, what about you? What's something that you're currently doing or trying to do on a regular basis that is contributing to better sleep?
So something I picked up in therapy, oh goodness, probably 3 years ago or so with a counselor, is almost a mindfulness technique. And so it's a form of meditation. So it's similar to what, she was just saying with focusing on breathing. But I actually to try to push other thoughts out of my mind. I actually picture myself somewhere. I picture wind, so noise. That way I can't, basically just giving myself an audio shield. And I actually do it in a form of if a thought enters my head, I observe it and kind of let it pass by. And I try to let that be a way of not letting ruminations or whatever I might be stressing about that moment, or even just, man, what should I have for breakfast? I mean, something silly like that. All of because I've got ADHD real bad too. So, usually if I give myself a mindfulness style environment in my head, it'll help me calm down, chill, and improve, and basically get my brain ready to just shut down and actually go to sleep.
Yeah, I love what you're talking about, the mindfulness exercises and relaxation, same bedtime every night, because, and the thoughts, like anime, it really is controlling your thoughts. So if you are saying, oh my gosh, I'll never get to sleep, and then I'll never function tomorrow, and then you just start worrying and worrying and worrying. So it's much better to say, let me just rest a little bit. Let me get up for a few minutes, see what happens, go to bed when my eyes are ready to close again. That would help.
Yeah, we've heard the old saw about counting sheep or counting from 100 backwards, kind of like an anesthetist. Does that work, or has anybody tried that?
That worked for me. That worked for me.
I would argue that that's a form of mindfulness technique. That's kind of what I would argue. Anything that would anything that is rote and repetitive and not conscious thought, I would say, is probably, at least that checks the boxes of kind of what my counselors have said before.
Jet, you said something before about visualizing, and I've heard some counselors suggest if you've got problems or issues, pick a happy place, even during the day, whatever. Is that something that might help sleep?
So that's basically what I do. So I mentioned that I picture an environment. I actually picture a very specific thing, and I do the exact same thing every time. So there's this one mountain, funnily enough, me and my girlfriend were just on this mountain range the other day, which is kind of fun. It's called 10 Mile Range in near Breckenridge, Colorado. But there's a big rock up there. And the very first time I was up there, I actually did meditate on the rock. Very cheesy, but you know what? I still did it. And, I was listening to the wind, and I was thinking about just nothing. I was letting the wind be in my ears, loud wind. It's really cold up there. And just kind of practicing exactly what I talked about with my counselor. And that's where I go every time. So the wind noise isn't random. It's something that I imagine, and I put myself in the same place on the same rock, looking at the same, just like trees and just green, nothing. And that's the place I always go whenever I'm trying to sleep and I'm trying to do something healthy about it. That's the healthy I try to do. Is I go back to that mountain range, I go back onto that rock, and I try to think of nothing and let myself go to sleep.
I'd like to step back for a second, Dr. Savoy. You're a specialist in sleep matters. How did you make the decision to get into that field? Did you have sleep issues back in undergraduate school?
Well, I'm not a sleep specialist. I'm a psychiatrist. I'm also specialized in addiction psychiatry and addiction medicine. So because of that field, I come across folks who have problem with sleep problem. And as we were hearing about self-medication, which is one of the common thing most of the time I hear, you kind of hit the target that as I was getting trained. I come from India. I did my med school training in Ukraine, psychological shocks of learning the new language and then coming to US, coming to a different culture and getting trained here. It's all kind of a shift from culture to culture. It all affected personally too. I can see the struggle of sleep, so I don't have to just read from the textbook. I personally have gone through that, various struggles of sleeps. But this is something I can relate even in my clinical practice when folks are talking about these various problems of sleep.
It's always good to have a doctor who has helped heal thyself.
Yeah, who has that personal experience too.
I think we all have sleep issues at different times. There's a lot of stress in our lives. Like you said, you have a 2-year-old daughter. I am not a veteran myself, but I can only imagine deployments and that sleep wake cycle really getting disturbed. And if your circadian rhythms are off, so you're not getting up when it's light, going to bed when it's dark, and you're not able to get that sleep drive going, sleep is going to be difficult.
Yeah, absolutely. Right. Whether you're a veteran or non-veteran, you might experience some of this. To our team of veterans, Raymond, is there anything that you're hearing in this conversation that maybe you haven't tried before, but that resonates with you and that you might want to try in the future?
I've done so much research on it. I've heard all this stuff already. But I don't know, maybe like the mindfulness aspect. Maybe that'll help. That's something that I've never even considered.
Yeah.
I'm just like, I can't do that. I've tried meditating, and I'm just like, I need to move. Like, this is too still for me. So maybe I'll take that into consideration.
It might not be today. It might be next week or next year that you try something like that out. Anime, is there anything that you've heard in the conversation that kind of you haven't tried before, but it resonates with you and you'd like to try it in the future?
Well, there's something that I've just been thinking about, and that was briefly mentioned tonight, was about the blue lights, right, from our electronic devices.
Yeah.
And I just learned earlier today that there's actually something you can purchase that you can put onto the device so that I'm not quite sure how it modifies the light, but so that it has less of a impact. And I don't know the science, but my understanding is that is supposed to help. And so I'm going to be looking at,
Doing some more research on that.
Yeah, to
that's
try
such a
to
cool
see where I
idea.
can buy something like that.
Excellent, excellent. Well, when we return, we're going to talk about the risk factors and treatment for the most common sleep problems and answer viewer questions. So stay with us.
Honestly, I'm not really sure why I'm calling. It's just...
I'm having nightmares.
My husband and I, we're just fighting a lot.
I can't get any sleep.
Things just keep getting worse, and it's starting to feel like I can't do this by myself anymore.
We could use some help figuring things out.
Okay. Well, I'm glad you called. Why don't you tell me more about what's going on? There's no wrong reason to reach out for crisis support. Whatever you're going through, the Veterans Crisis Line is here to help. Visit veteranscrisisline.net to learn more.
We're talking about sleep issues with veterans. If you're watching live, we invite you to be a part of the conversation. Call us at 925-313-1170. Send us a message through Facebook at Veterans Voices 1 or email us at veteransvoices@contracostatv.org. We want to hear from you. As we learned in our last segment, the most common sleep problems that veterans face are obstructive sleep apnea and insomnia. So now we want to spend some time talking about who's at risk and how these things can be treated. So I'm going to start with Dr. Varghese. What kind of things put people at a higher risk for obstructive sleep apnea?
Yes, that's a very good question. Obstructive sleep apnea, let me start with the definition. There are a period of partial or complete obstruction of sleep, obstruction of breathing during the time of sleep, and that makes the oxygen saturation or oxygen content of the blood goes down, and that arouse or distract them to, or make them to get out of the sleep. So this is a pattern that can happen because they have this complete stop of breathing due to various risk factors. So let me walk you through some of the risk factors that you can see here. That is gender-wise, you can see that male are more prone to have obstructive sleep apnea. There's a family history. Age factor is there. As people get aged, they can develop the obstructive sleep apnea issue. Body mass index, obesity, smoking. Certain genetic factors are also very important in developing this problem. Alcohol use and illicit drug use can create a problem. Kind of the way in which a person sleep also matters. And then, of course, as previously mentioned about the anatomic structure, that is the structure of the airway can obstruct sleep, and that creates breathing problems.
There's quite a few things to kind of keep an eye out there and sort of do a self-evaluation there. Once it's identified that you do have sleep apnea, how is sleep apnea treated?
If I may add one thing first, so just another thing on assessment, there's a questionnaire called the STOP. And basically, if you score 2 or more on the stop, that would be worthy of talking with your doctor. So as Dr. Varghese was saying, first it's snoring. And it's not just, minor snoring. It's so loud you can hear it through the door. Like you talked, I think, Jed, about the battle buddies complaining about your snoring, or Raymond.
Yeah.
Being tired, really feeling fatigued during the next day. Observe stop breathing or gasping during the middle of the night, often by a bed partner, and high blood pressure, treated or not. And then if you have 2 or more of those, check with a doctor. And then Dr. Varghese, the treatment of sleep apnea.
Yep, that is exactly, the first important step is that you have to diagnose it correctly. And there are level 1 way of diagnosing the problem and level 3 way of diagnosing the problem. Level 1 is the one can be done. Doctors send them with a machine to the home, and they do try to understand, is there any basic obstruction happening in the airway? Level 3 is a very complex study done in the hospital itself, and the sleep specialists do that in a very extensive way. They try to understand the problems of the sleep, whether it's obstruction or whether it's brain pathology, various things they do in order to understand that. Once the person identifies the problem, the gold standard treatment for sleep apnea is called the continuous positive airway pressure therapy, for CPAP machine treatment. There are surgical treatment also, which means that if there is any obstruction in the airway, you can do the changes in that pathway to create to clear the pathway to have proper breathing. There is no medications. Unfortunately, we don't have any medications for treating sleep apnea. Corrections can be made by removing the soft tissues, and even sometimes we can use some oral appliance to help them, to increase that airway pathway for them to have normal breathing. So those are the few treatment options that I shared here.
Yeah, thank you. CPAP is the one that I've definitely heard a lot about amongst our veterans.
Question, what kind of things put people at a higher risk for insomnia?
I can start with that. So insomnia is defined as difficulty falling asleep, staying asleep, or having early morning awakenings, so waking up a lot earlier than you intended. It also causes significant distress the next day in terms of daytime functioning, work, relationships, and it occurs even though you have the opportunity to sleep. It needs to be present 3 or more times a week for at least 3 months. And so in terms of the risk factors, there are many. One of them is being female. It can also get worse when people are going through hormonal changes like menopause. Age. So if people that are older, as we talked about during the sleep architecture structure segment, also have more difficulty sleeping, more broken, fragmented sleep, less restorative sleep. So divorced, separated, or widowed, when you're going through those periods of time, life stressors can be very challenging, not having social support or having less or having custody battles, all those kind of things, having a newborn or even a 2-year-old. Rotating or variable work shifts, that can be very difficult. And so that's something very present in the military, working first shift versus third shift. We are not accustomed to doing that. Ideally, we wake up in the morning when it's light, we go to bed when it's dark. And Raymond had talked about, that's one of the best things you can do is get up in the morning, go outside, get that melatonin, get some sunshine. And other risk factors, being too involved in the job, being really stressed out, having poor health. And then there are different body issues that can happen. So digestive issues. Imagine if you're trying to digest your food all night or you're up frequently going to the bathroom, it's going to disrupt your sleep and create likelihood for insomnia. And cardiac issues, prostate disorders in men, and all those things can contribute to issues with insomnia.
So the general treatment, or are there individual treatments for each of these?
Yeah, I'll start with the non-pharmacological, the non-medication assisted treatment, and then Dr. Varghese can take the medication one. The best treatment for insomnia, believe it or not, is actually cognitive behavioral therapy for insomnia. So Charlie Bravo Tango. And please, if you are in VA or another setting, a vet center, wherever you are, ask for it, because it's not always going to be told to you. So if you go to mental health, behavioral medicine, primary care, mental health integration, primary care, ask for CBT for insomnia. So just a few tenets of it. It's not long. It lasts about 6 weeks, sometimes maybe 8 sessions. I have been shocked with how well people have gotten better with their insomnia after just a few weeks. If people do the assignment, they do the sleep hygiene, they do the sleep diaries. I do all kinds of empirically based psychotherapies. And this one is my favorite because it works so quickly. So one of the first things is sleep efficiency training. So we're going to limit your time in bed. This is also sleep restriction. So some people don't like this. It doesn't last too long. But let's say you hang out in bed for 10 hours and we kind of figure out that you only need maybe 6 or 7 hours based on measures we do. We're going to have you in bed for 7.5 hours, okay? And no more than that. So if you don't sleep at all, you still get up. Same bedtime, same wake time. And then we gradually increase it. So we might go to 7.5 or 8 to figure out exactly how much sleep you need. This is going to teach you again that the bed is for sleep and sex and sickness, nothing else. You're not going to hang out and worry in bed. That's one of the worst things you can do. And incidentally, with sleep hygiene, I forgot to mention that you want to check the temperature in the room. Right now in Sacramento, it's 100 degrees. I don't want to be sleeping in 100 degrees. My bed partner and we may have differences in temperature. You got to negotiate that. More covers, fewer covers, a fan, white noise machine, all those things. You want to keep it quiet too. There's also stimulus control as part of the CBT for insomnia. So this is making sure that you, again, know that the bed is only for sleeping, sex, sickness. Sleep hygiene is a big part of this. Cognitive restructuring, which Anna May had mentioned, very important. So this is where you want to change some of those thoughts that are making it worse. If I don't sleep, nothing's going to happen, or everything's going to go horribly the next day. Probably not. You've thought about sometimes when you haven't slept well and still got through the day. And then relaxation, incredibly important. And mindfulness, really thinking about ways to calm yourself before you go to sleep, like I said, and kind of calm that racing mind. The other thing is you want to make sure that you're physically active enough during the day. Sometimes when people retire or stop working or change their routines, they're kind of watching TV all day. That's probably not real conducive to sleeping well at night. So that is my favorite therapy. And Dr. Varghese, what about medication?
Yeah, medication is that's a little complex thing to explain. I try to divide the medication aspect into 3 systems that we target. One system is called GABAergic system, second system is called arousal system, and third system is called the orexin system. These are all specific targets and specific treatment modalities are there. So doctors, when they, when the folks go to see their doctors, the doctors will assess them and talk to them. Every medication has its own benefits, risk and benefits. There are side effects side effects profiles are there. You got to have an individual approach to that, and the patient-doctor interaction will help them to understand specifically what system they want to focus, and everything kind of depending upon their evaluation too. Not all medications are not meant for everyone. So based upon the specific reason that causing the insomnia, they will choose the systems and they will try to treat them accordingly.
We got a viewer question we could throw in here. Thomas from San Ramon asks, I'm an Air Force veteran who has not slept a full night since I transitioned 5 years ago. Just thought, is this how things are? What would be my first step if I wanted to change it? And that's probably a question for a lot of viewers is, what's step number 1?
You don't have to live this way. There is hope. There is help. Like I said, the kind of behavioral therapy for insomnia, I would try that as a first line, and then medication later, because medication can be tricky to get the right one. There is medication that's used for nightmares too. But try one of those therapies, and then maybe a sleep study is warranted, but also it's really important to check on medical conditions. Is there something underlying going on that's interfering with your sleep? What would you say, Dr. Varghese?
Absolutely. I think the common thing is common. Like a lot of people who suffer with obstructive sleep apnea, it can present as mild obstructive sleep apnea. You don't have to have that excessive, that typical snoring sound and things like that. It can be mild, and that could be one reason why a person is struggling with insomnia. And if you go to the doctor and get that right evaluation done, as I said, there are different kinds of level of evaluation, level 1, level 3. If you need a level 3 evaluation, that's a little complex evaluation. I'm not going to say the jargon name here to make people confused, but there is a level 3 is a very complex treatment modality where you try to specifically find out why the insomnia is happening. Sometimes people develop seizures during the sleep, and that is not known to them unless they investigate that. And during this level 3 investigation, if there is a seizure activity happening during the sleep, if you identify it, you treat that seizure, and that will help the insomnia.
And I'm wondering too, for the caller, what do the veterans think on the line here? What would you say to Stephen?
So the real first step is picking up the telephone and calling your primary care doctor to make an appointment, right? Because these other things that are being spoken about have to come from a referral from your primary care. And so you really have to be willing to go to the doctors. And then I think the other thing is that when you get to the doctors, a lot of times, myself included years ago, by the time I got there, I didn't have anything written down. So I didn't remember everything that I wanted to say. And I didn't communicate really what was going on with me, because also I was concerned about appearances and that I'm competent and that I can do things, and I can take care of myself and I'm strong. And I didn't necessarily want to talk about not being able to do that. And so the second step is you're in the office and now willing to be vulnerable and talk about what's really actually going on and describe it, what's really actually going on, so that then the provider can actually make a plan based on what's really going on in your life. Mm-hmm.
Can I just say, I love important. Those tips, Anime. I always tell veterans when I talk to them, you got to really break it down, very basic. First step, pick up the phone, talk to your primary care provider, because a lot of folks don't know how healthcare system work outside of the military, and they don't understand that, well, you do need to talk to your primary care first. And then I love what you said, Anime, about taking notes. And taking notes could be awkward. It could be pulling out a paper and pencil. I pull out my iPhone and I just tell my doctor, I have some memory issues, so if you don't mind, I'm going to be taking notes about our conversation. So I really love that point. We have a viewer question here. Betsy in Danville, she asks, my husband is a 20-year Army veteran and he refuses to listen to me when I tell him that he stops breathing in the night. How do I talk to him about this?
I think this is an interesting question that you have to understand. The problem is more of a medical problem, and in a long term, you have to kind of understand the risk and benefits. If you don't treat the sleep apnea in the right time, it can further graduate into cardiac problem, that is heart problem. Person can develop coronary artery disease, which can lead to myocardial infarction, that is heart attack, high blood pressure. People can develop, 50% of the time when people don't treat their sleep problem can lead to psychiatric problems, such as anxiety, depression, so then the root of the problem is a medical problem that leads to a mental health problem. So I will emphasize the importance of, it's a foresight thing that you have to kind of look into that future, that if I can take care of this small issue right now, I can avoid big problem in the future. So that's the way I will recommend to approach.
And Raymond, how did you decide to come forward about your sleep apnea?
I started doing research and realized that a lot of veterans have this problem, and realized that it leads to fatigue, and it was a possible answer for why I'm always tired. So I'm just trying to figure it out and trying to answer that question. And yeah, that's how I got through it.
And you asked for help. You picked up the phone, like Anime was saying. You got the help. There's a lot of help out there.
Yeah, yes, definitely. And even with this, I'm learning that there's a level 3, level 3 something that I wanted to ask you, Dr. Varghese.
Right.
Is that something that the VA does? Like, can I ask the VA to do that?
Yes, the level 3 treatment is called, the jargon name, medical term is called polysomnography. It is a very complex study of the brain activity with the electroencephalography, electrocardiography, the breathing patterns. They look into the muscle pattern, how the muscle works during the time when you sleep. So they look into many aspects of the sleep that contributes this problem. So that's the level 3 that can only be done in the hospital, and that is in a very comfort level. And nowadays we have excellent, polysomnography labs, sleep labs. And these labs are high tech, it's like state-of-the-art, facilities with all sort of backup. Like they have neurologists working there, psychiatrists working there, pulmonologists working, the doctors who take care of the lungs, and other therapists. So it's a group of doctors working together to identify the problem of sleep.
Well, it sounds like there have been so many great suggestions on the show tonight, and I'm really, I found it extremely interesting to hear directly from our veterans themselves about what works for you and how you kind of got to that point. Everyone had different perspectives and different timelines on that. So very fascinating conversation tonight. That is going to end our panel conversation for the evening. I want to thank all of our guests, our veterans, and our subject matter experts from the VA for sharing their stories with us tonight. Thank you.
We hope you have enjoyed our conversation tonight. We leave you with some resources if you found our conversation inspiring. The U.S. Department of Veterans Affairs has a wealth of information and resources related to sleep issues. To access it, go to va.gov and search sleep. The National Center for Post-Traumatic Stress Disorder exists to help those suffering from post-traumatic stress. Reach them at ptsd.va.gov. National Association of County Veteran Service Officers is a great place to begin your search for veterans resources. Find a county service officer near you at nacvso.org. Veterans Voices is brought to you in part by contributions from the Diablo Valley Veterans Foundation, dedicated to helping veterans near you. American Legion Post 246, honoring the tradition of the American Legion in Danville. If you would like to help sponsor Veterans Voices, you can donate to Veterans Voices, care of Diablo Valley Veterans Foundation. Get in touch with them at diabloveterans.org. To rewatch tonight's episode, check back on our homepage later this week or check your cable provider's schedule for rebroadcast times. You can also rewatch this episode and many others on our YouTube channel, Veterans Voices of Contra Costa. So be sure to subscribe. Our next show will air on Monday, September 11 at 7 p.m. We will be talking about vets and pets. You won't want to miss it. To all our veterans and their families, thank you for serving. To all of you who tuned in tonight, thanks for watching. Have a great evening.